Hey, mister!
It's your turn. You're gonna buy those or not?
Huh? Oh yeah, I'm sorry. I'll just take this guy as well.
Thank you. Come again.
Something have happened?
It'll be another 5 minutes before the doctor's helicopters get here.
Where's the stretcher? Someone take this patient out of here. Damn it, it's no use over here.
Quit standing around.
Hey,
Get
put
stable
those
victims
rubberneckers
ready
back.
for transport.
Allow me to help too, miss.
You're that Eagle Man from the papers.
That's just some bad press. Let's focus on saving this patient for now.
All right.
He has several broken bones. What hospital can take him?
Everywhere's full. We're sending the rest to Resurgam.
You're transporting them to Resurgam First Care? But...
Don't worry, our orthopedics department is top-notch. Hey!
Hey! Isn't that the Eagle Man? That's him! He must have been behind all this!
What? No, I had nothing to do with all this.
No more excuses! Hey, police! Here's the culprit! He's getting away! Get him! Get back here, you filthy coward!
No, I'm not!
Where have you been, Hank? Stop playing around and get ready!
Oh, sorry.
What is it? Is there a problem?
Oh, no. But I've lost sight of why we're saving people's lives.
Quit thinking about useless crap like that. There's a patient here. Now isn't the time for this.
You're absolutely right. Now, let's begin the operation.
We've got multiple patients this time, so let's treat them as fast as we can.
Indeed. This is our first patient. The wounds are in the right leg. Let's make an incision and see what's inside. The tibia is chipped.
We should fill it with synthetic bone. Better do this quickly.
Wait, first we need to prepare the connecting area. Then we'll use the synthetic bone.
Okay, you're the specialist. I'll let you make the decisions here.
All right then, set the saw. Let's make an excision along the guideline. Good. Cautiously continue on.
Good. That should prepare the connecting area. Now to form the synthetic bone. The shape to cut is already shown on it. Use the laser to cut it out.
All right, let's proceed. Be careful.
Looks like you're on a roll. What was that static? We should wait until the guideline comes back. time we bought a new machine.
Rock solid. The synthetic bone's been shaped. Let's move on to the next step.
All right, put the synthetic bone in the correct position.
Well done. Right, now to secure it with a plate. Prepare the drill.
Drill deep enough without touching the guidelines, okay? Wait! Hey! You drilled too far!
Can you bring out the plate? Let's screw it in place. Good. Cautiously continue on.
Good. It's going well. The femoral neck is the next step.
This is awful. This area has been completely shattered.
Looks like we have no choice but to replace it with an artificial joint.
Right, let's start this quickly. First, we have to extract the bone fragments.
Alright, keep going with the other pieces too, okay?
Get the saw. We need to work on it so that the stem can be driven in.
Don't leave the guideline. Using a saw isn't like using a scalpel, after all. That was pretty good!
That should do it. Can you bring out the stem?
Make sure it's secure, but don't hit it too far in. Got it?
Good. It's been driven into the right point. Sorry, it was a little too hard there.
Hey, go easy on that thing, okay? In any case, attach the ball now. Drive it in up to the guideline, okay? All right, that's it. Continue on.
Now to treat the acetabulum. Go slow and careful, right down to the guideline. Get me the cup. I'll begin attaching it.
Drive it down to the guideline. Watch how much force you use. All right, attachment complete.
Now let's fit in the hip joint. We'll be done with this patient's treatment then. All right, we're done here. Let's close up this patient.
Here's the stapler. Match the guide and staple the incision closed.
That was pretty good. All right, bring in the next patient. We'll begin treatment immediately. The damaged area is the left leg. Let's begin the procedure.
Back is killing me. Let's finish taking care of this guy already. There seem to be multiple fractures, but it looks like we can treat the cervical neck with pins. However, the rest of it's going to need to be secured with a plate.
That seems like the appropriate treatment. Let's start by collecting the bone fragments.
All right. Pieces have been picked up. Now put the fibula back in its original position. I'll bring out the fragments we've retrieved. Put them back into place.
Looks like you're on a roll.
Good. All the fragments are back in place. Let's begin treating the fibula.
Use the drill to open a hole. Watch out for the guidelines. Good. I'll get the plate and screws ready. There's a total of 4 screws. Tighten them up to the guideline.
Rock solid. Let's move on to securing the fibula. Get the drill. We just need a single hole for the pin. Rock solid. Let's get this pin in there now.
Don't drive it in too far, okay?
This seems to be all right. Let's continue the treatment.
All right. Looks like it's properly secured now.
The femur's next, right? Let's proceed.
Wow. This is severe. Will it need an artificial joint?
That'd be the best way. Let's scrape the neck and attach a cup. Bring out the cup.
Yeah. Make sure it fits completely, okay? It's useless if it's full of gaps. Watch yourself. Make it fit the guide. All right. Good. Keep it up.
Rock solid. It's firmly in place.
The acetabulum is next. Attach the cup over here as well. Careful now. Scrape it down to the guideline.
Now to attach the cup. Let's fit this in precisely.
Watch yourself, okay? Don't use too much force. Nicely done. You're a damn fine specialist.
All you need to do is care about your patients. Let's fit this on the plate. Treatment complete. Let's close this patient up and end this. Ready the stapler. Closing the patient up. Good. Cautiously.
Well done. All the patients have been treated.
We pulled it off. All that's left is to hope the patients recover.
No problems. It went perfectly, as usual.
Any other patients? How was the surgical side?
The kid's handling those. They'll be difficult, but I'm sure he can pull it off.
Well, now this is new. Something bothering you?
That's when I made up my mind. I decided that I'd be an awesome hero who would save people.
Have you stayed in contact with the child you rescued?
Huh? Oh, that reminds me. I heard a letter came for me. I've been so busy that I haven't had time to get it.
I see. There's an important point you're missing.
Huh?
There's a limit to what even a hero can do by himself. A hero acting on his own only acts in vain.
Hey, Hank! What's the matter? You leaving?
Yeah. I'm going back to my room.
Ah, been wondering where you were.
Oh, Gabe! Oh, sorry.
It's okay. You, free after this? Wanna grab some drinks? Well, I mean, it's totally fine if you don't want to.
Actually, I'd love to come along.
Yeah, no worries. Maybe some other time. Or... What? You're actually gonna come?
Would that be a problem?
What? Of course not, big guy. And hey, it's on me this time, so just go nuts.
Well, I wouldn't want to overdo it.
What? You never come along. You're not getting off easy.